Okay, Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Shakir bin Ma'amin and my matric card number is 201 D2019109031. Okay, today I'm gonna talk about the introduction of the environmental changes. For the introduction, environmental change is a change of disturbance of the environment, most often caused by human influences and naturological processes. Furthermore, other factors are influenced by such as natural disaster, human interference, or animal interaction. Thermoregulation means human produce or lose heat through the thermoregulation to maintain body temperature, hemostasis, and to protect themselves from excessive heat or cold. Furthermore, environmental temperatures can affect physiological reaction to exercise through the thermoregulations. For example, shivering or vasodilation. Okay, next I will pass to the next presenter. Thank you.
Hi, my name is Muhammad Afif. So today I will present about seizures. Okay, the seizure is uncontrolled electrical activity in brains, which may produce a physical confusion, minor physical signs through disturbance or combination of symptoms. Okay, the type of symptom and seizure depend on where the abnormal electrical activity takes place in the brain. Okay, next is seizure have a two type, seizure in adult and seizure in child. Okay, for seizures in adult, for recognition, seizure often follow a pattern. Firstly is sudden loss of responsiveness. Second, rigidity and arching of the back. Breathing may be noisy and become difficult. The limb may show a grey-blue tinge. Okay, next is convulsive movement begin. Saliva, possible loss of bladder or bowel control, muscle relax and breathing become normal again. Procedure to take care of patient. Firstly is protect the casualty. Okay, try to ask the casualty for. Talk to him calmly and visually. Clear away any potential dangerous object to prevent injury to the casualty. Ask the bystander to keep clean. Make a note when of the seizure begin. For second step is protect head and loosen tight clothing. If possible, cushion the casualty head with soft material until the seizure passes. Place banding around him to protect him from objects that cannot be moved. Loosen any tight clothing around the casualty neck. For the step is place casualty in recovery position. Once the seizure has stopped, the casualty may fall in a deep sleep. Open the casualty airway and check breathing. If he is breathing, place him in the recovery position. For step 4 is monitor casualty recovery. Breathing, pulse and level of response until he recovery. Note the duration of the seizure. For the next type of seizure is seizures in child. Okay, for recognition, firstly is loss of impaired response. Next is vigorous shaking with clenches, fist and arched back. Okay, sign of fever such as hot, flushed skin, twitching face and squinting, fixed or upturned eyes. Okay, next is breath holding with red, puffy face and neck. Okay, rolling at the mouth, possible vomiting, and last is loss of bladder or bowel control. Okay, next is procedure to take care of child. Firstly is protect the child from injury. Clear away any nearby object and surround the child with soft bedding, such as a pillow or roller towel, so that even your leg movement will not result in injury. Second step is help the child cool down. Remove bedding or clothing, such as a vest or pajama top, or you may have to wait until the season stop to do this. Ensure good supply of cool air, but do not let the child become too cool. Okay, for the third step is place the child in recovery position. Once the seizure has stopped, open the airway and check breathing. If the child is breathing, place him in the recovery position. Okay, for the last step is call for emergency help. Call 999 for emergency help. Assure the parent or carer if necessary. Monitor and record the child vital signs, breathing, heart, level of response, and temperature while waiting for the help to arrive.
Hello, my name is Spencer. I will present about Hirschhausen. What is Hirschhausen? Hirschhausen is a condition whose symptoms may include heavy sweating and a rapid pulse, a result of your body overheating. For the recognition, Hirschhausen occurs when the body can no longer keep blood flowing to supply vital organs, and at the same time and send blood to the skin to reduce the temperature. Both signs and symptoms of Hirschhausen include headache, dizziness, confusion, loss of appetite, nausea, sweating with pale, clammy skin, cramp in the arm, leg, or abdomen, repeat weakening pulse and breathing. What will will to do if this Hirschhausen occur in field, especially in massive sport event? First, we need to move the athlete into the shaded or air-conditioned area. Encourage him or her lie down and rest and support his or her leg above the heart level. After that, we need to give the athlete plenty of water and or drink. Our rehydration is because it is very important. Our rehydration cell or isotonic drink will help with cell replacement. After that, for the step number third is monitor and record vital sign, level of response, breathing, and pulse. Even if the casualty recover quickly, advise him or her to seek the medical help. This is last step. If the condition persists, we need to seek the medical attention. For the detail, we can watch this video.
Suffering from heat exhaustion, help the person to a cool place and get them to lie down with their legs raised. Give them lots of water to drink, and you can also give them an isotonic drink to help replace the salt in the fluid that they have lost through sweating. Keep checking their level of response. If their condition seems to be getting worse, place them into the recovery position and call 999 or 112 for emergency help. So remember, help them lie down in a cool place, raise their legs and give them water to drink. And that's how you treat someone with heat exhaustion.
Okay, Assalamualaikum warahmatullahi wabarakatuh. Okay, my name is Muhammad Nazrin bin Ibrahim. Okay, now I will present about the heat stroke. Okay, what is this heat stroke? Heat stroke? Heat stroke can be defined as a condition that caused by the body overheating, which usually act as a result of the prolonged exposure to or the physical extension in the high temperature. Okay, heat stroke, which is the most serious form of the heat injury, can be occur if the body temperature is rise to 104 Fahrenheit or 40 degrees Celsius or become more higher. Okay, there are a few recognition for the heat stroke, which is the main sign of the heat stroke is high body temperature. A core body temperature of 104 Fahrenheit, which is 40 Celsius or higher, can be obtained by using the rectal thermometer. Okay, the next sign is altered mental state or behavior, like confusion, agitation, and slurred speech is the sum of the result that come from heat stroke. Next is alteration of the sweating. Okay, there are a few difference between sweating during the hot weather and sweating using the strenuous exercise. Okay, in the heat stroke that brought by hot weather, your skin will feel hot and dry to touch. However, the heat stroke that brought during the strenuous exercise, your skin may feel dry and or slightly moist. Okay, next sign is flushed skin, which is the skin may turn red as the body temperature become increased. Next is rapid breathing, which is the breathing become more rapid and shallow. Okay, lastly is the racing heart rate. Okay, which is the pulse may significantly increase because of the heat stress placed at a tremendous burden on the heart to cool up the body. Okay, what can we do if someone around us have a heat stroke? Okay, for the first step is move the person to the cool place and remove as much as possible his outer clothes. Okay, next is help the person to sit down and support him by the cushion to make sure that the person is comfortable. After that, rub him with the cold or wet sheet until his temperature under the tongue decrease to 38 Celsius, or the temperature under his armpit decrease until 37.5 Celsius. Okay, keep the sheet wet by continually pouring some cold water over it. Okay, if there is no sheet available, we can fan the person or sponge him with a cold water to make sure the temperature become decrease. Okay, after that, once the patient temperature appear to return to the normal, replace the wet sheet with the dry one. Okay, after that, always monitor and record the vital sign like breathing, pulse, level of response, and the temperature while waiting the help to arrive. If the person temperature rise again, repeat the cooling process as above. Okay, as you can see in the screen, this is the difference between the heat exhaustion that my friends talked about before and the heat stroke, which is the topic that I talked about just now. Okay, now I want to share some example video how to treat a heat stroke patient.
Heat stroke is a true medical emergency. Dial 911 immediately if there are signs and symptoms of heat stroke. Move the victim to a cool place. The best way to cool a heat stroke victim is to immerse them up to the neck in ice water. If this is not possible, cool the person down by any means possible. If immersion in ice water is not possible, take the victim to a cold shower or move to a cool area and cover as much of the body as possible with cold, wet towels. Do not try to force the victim to drink liquids. Be sure to monitor the person's breathing until help arrives and be ready to give CPR if needed.
Assalamualaikum warahmatullahi wabarakatuh. My name is Mama Sabar bin Seti. Now I will will present about the allergy reaction. What is allergy? Allergy is an abnormal reaction of the body's defense system, which is immune response to a normally harmless trigger substance. Allergy can present itself as a mild itching, swelling, wheezing, or digestive condition, or can progress to full-blown anaphylaxis or anaphylactic shock, which can occur within seconds or minutes of exposure to an offending allergen. Common allergy triggers include pollen, dust, nuts, shellfish, eggs, and bee stings, and certain medication. Okay, for the recognition allergy reaction, number one is red and itchy rash area of skin, also known as whisk. That is a rash, itchy rash that appears on the skin. It may appear on one part of the body or be spread across large areas. Number two is red and itchy at eyes. This is inflammation of the membrane that covers the white of your eyes. Sometimes this happens along with nasal allergy symptoms. Number three, wheezing or difficulty breathing. Wheezing may occur during breathing out or breathing in. Inflammation and narrowing of the airway in any location from your throat out into your lung. Number four, swelling of hands, feet, and face. That is caused by flat thread in your body tissues. Number five, abdominal pain, vomiting, and diarrhea. The most common way to develop viral gastroenteritis, often called stomach flu, which is through contact with an infected person or by ingesting contaminated food or water. For the step-by-step procedure of care on allergy, number one is assess the casualty signs and symptoms, as if she has any known allergy. Number two, remove the trigger if possible, or move the casualty from the trigger. Number three, treat any symptoms. Allow the casualty to take her own medication for a known allergy. Number four, if you are at all concerned about the casualty condition, seek medical advice. That call 9 now. I will present about the anaphylactic shock. What is anaphylactic shock? This is a severe allergic reaction affecting the whole body. It may develop within seconds or minutes of contact with a trigger and is potentially fatal. In an anaphylactic reaction, chemicals are released into the blood that widen blood vessels. This causes blood pressure to fall and air passage to narrow, resulting in breathing difficulties. In addition, the tongue and throat can swell, obstructing the airway. The amount of oxygen reaching the vital organs can be severely reduced, causing hypoxia. Common triggers include nut, shellfish, egg, latex, bee sting, and certain medication. A casualty with anaphylactic shock need emergency treatment with an injection of further recognition anaphylactic shock. The recognition among allergic reaction and anaphylactic shock is the same, but there may also be. Number one is difficulty breathing, from a tight chest to severe difficulty causing the casualty to wheeze. Number two, pale or flushed skin. Number three, visible swelling of tongue and throat with puffiness around the eyes. Number four, feeling of terror. Number five, confusion and agitation. Number last is signs of shock leading to collapse and unresponsiveness. Now, step-by-step procedure of care on anaphylactic shock. Number 1 is call 999 for emergency help. Tell ambulance control that you suspect anaphylaxis. Number 2, if the casualty has an auto injector of adrenaline, help her to use it. Number 3 is help the casualty to sit up in the position that best relief and breathing difficulty. Number last is monitor and record vital signs, which is breathing, pulse level of response while waiting for help to arrive. Okay, this video can show.
Hi, Captain Wayne here. In today's video we're going to cover how to treat anaphylactic shock with an EpiPen. Anaphylaxis is a severe allergic reaction to a substance causing your blood pressure to drop.
So, Assalamualaikum and salam sejahtera to our lecture. Today I'm Karanwa. We present about heart attack. So, what is heart attack? So, a heart attack also called a myocardial infection. So, it's a cure when the flow of blood to the heart is blocked. So, the blockage is more often build-up of fat, cholesterol and other substance. For signs and symptoms, firstly, the patient will feel pressure, tightness or pain or squeezing or itching sensation in your chest, your arm, and then maybe spread to your neck or jaw or your back. The next is nausea, indigestion, heartburn or abdominal pain. Shortness of breath. This often come along with chest discomfort, but shortness of breath also can happen before chest discomfort. Cold sweat, fatigue, lightheadedness or sudden dizziness. What to do if you face stranger with those symptoms? First, you need to relax first and then call your 911 or 112 for emergency help straight away and tell them you think someone is having a heart attack. The second is help move the casualty into a comfortable position. The best position is on the floor with their knee bent and their head and shoulders supported. So next, give them one aspirin tablet and ask them to chew it slowly. Aspirin can help your blood from clotting, and then do not give aspirin to patient if the patient with the allergic to it. Keep monitor the casualty level or response until emergency help arrive. If they are responsible at any point, prepare to start CPR. So you need to continue giving CPR until medical professional arrive or until person with formal CPR training can take over. So next we're gonna see video how to handle it.
A heart attack happens when the supply of blood to the heart muscle is suddenly blocked, usually by a blood clot. Lots of people make a full recovery, but there's a serious risk that the heart might stop beating, called a cardiac arrest. It's vital that you help someone who's having a heart attack and call 999 or 112 for emergency help straight away. People who suffer from angina are at increased risk of having a heart attack. Angina is chest pain, often described as a heaviness or a squeezing pain in the chest. The pain should ease within a few minutes if the person rests straight away and takes their angina medication. If the pain does not settle, it is safer to presume it's a heart attack. If you think someone is having a heart attack, they may show some of the following signs. Pain in the chest, which could spread to the jaw, neck, or arms. Breathlessness. Discomfort in the stomach similar to severe indigestion. Collapsing without warning. They may suddenly feel faint or dizzy. They may experience a feeling of impending doom. Pale skin with blueness at the lips. They may have a rapid, weak, or irregular pulse, sweating, or be gasping for air. If you do come across someone with these symptoms, call 999 or 112 immediately and say you think they're having a heart attack. After you've made the call, help move them into a comfortable position to help ease the strain on the heart. The best type of position is sitting on the floor with their head and shoulders supported and their knees bent. Place cushions behind them and under their knees. Then, if you can, and if they're not allergic, give them an aspirin tablet, 300 milligram, and tell them to chew it slowly. Aspirin should not be given to someone under the age of 16. If they have angina medication, you can help them to take it. Encourage them to rest. While you wait for help to arrive, monitor their breathing, pulse, and level of response. Try to stay calm to avoid unnecessary stress. If they become unresponsive at any time, open the airway, check their breathing, and prepare to treat an unresponsive casualty. You may need to do CPR. So remember, if you think someone is having a heart attack, call 999 or 112 immediately, help move them into a comfortable position, and encourage them to rest. Give them 300 milligrams of aspirin to chew and help them with their angina medication if they have some. While you wait for help, keep checking their breathing, pulse, and level of response. And that's how we help someone who may be having a heart attack.
Lastly, the stroke. A stroke is a sudden interruption in the blood supply of the brain. The majority of strokes are caused by a clot in blood vessel that blocks the flow of blood to part of the brain. However, some strokes are caused by the ruptured blood vessel, which causes bleeding to part of the brain. If a stroke is due to a blood clot, it may be possible to give drugs to limit the brain and improve the recovery. So, there are a few types of stroke. First is the ischemic stroke. Second is the hemorrhagic stroke, and third is the TIA, or the transient ischemic attack. For the first one, the ischemic stroke, it is the most common type of stroke. It is where when the brain's blood vessel become narrowed or blocked, which then will cause severely reduced blood flow, or ischemia. The blocked or narrowed blood vessels are caused by fatty deposits that build up in the blood vessel or blood clot or other debris that can travel through the bloodstream and lodge in the blood vessel in the brain. Okay. Second is the hemorrhagic stroke. For the hemorrhagic stroke, it occurs when a blood vessel in the brain leaks or ruptures and cause the bleeding to the brain. The brain hemorrhage can result from many conditions that affect the blood vessel. The factors which are related to hemorrhagic stroke include the uncontrolled high blood pressure, overtreatment with blood thinners or anticoagulants, bulge at weak spots in the blood vessel wall, trauma, and also protein deposit in blood vessel wall that leads to weakness in the vessel wall. And for the third type of stroke, it is the TIA, or the transient ischemic attack. The transient ischemic attack, or TIA, is sometimes called a mini stroke. It is similar to a full stroke, but the symptom may only last a few minutes, which then will improve and eventually disappear. If we suspect a TIA, or transient ischemic attack, it is important to seek medical advice, as the TIA is somewhat we call like a warning to us that there will be stroke in the future. Next is for the recognition. As we can see in the slide, FAST, fast. Fast is a method to spot whether the patient got stroke or not. First, F is the facial weakness. It is where the casualty is unable to smile evenly and the mouth or eye may be droopy. We can see either side left or right maybe will be droopy. So for the A, which is arm weakness, the casualty is only able to raise one arm. Third is the speech problem. The casualty is unable to speak clearly. We can hear sound coming out from their mouth, but we cannot understand, or it is not very clear. And then there may be also a sudden weakness or numbness of the face, arm or leg, or both sides of the body. And then sudden loss of or blurring vision in one or both eyes. Sudden difficulty with speech or understanding, sudden confusion, and last is the sudden severe headache with no apparent cause. So for the first aid, what we can do first is we look at the casualty face. We ask the casualty to smile, and then we can assess. If he has had a stroke, he may only be able to smile on one side, and the other side of the mouth may be droopy. And second, we ask the casualty to raise both of his arms. Sorry. If he has had a stroke, he may only able to lift one arm. Third, find out whether the person can speak clearly and understand what we say. So in this part, we can ask questions such as, what is your name? Are you okay? And the casualty will respond. He maybe can talk, but we cannot understand what he is talking. So next is we need to call 999 for emergency help and tell ambulance control that we have used the fast guide and we suspect a stroke. Next, we need to keep the casualty comfortable and support. If the casualty is responding, we can help him to lie down and reassure him that help is on the way. And then we need to regularly monitor and record the vital signs. We should monitor the breathing, pulse, and level of response while waiting help to arrive. Do not give the casualty anything to eat or drink because it will be difficult for him to swallow as he is in the middle of a stroke. So I have provided a video demonstration for the what to do or the fast method. Actually, I have another video on the stroke on football games, but in the video it does not show the assessment made on the player. So we'll see the video about the fast for the fast.
A stroke can occur when the blood supply to the brain is disrupted and starves the brain of oxygen. Strokes are most commonly caused by a clot that blocks the flow of blood to a part of the brain, although some strokes can be caused by a ruptured blood vessel that causes bleeding into the brain. Call 999 or 112 for emergency help immediately if you think someone has had a stroke. If you suspect someone is having a stroke, you can use the FAST guide to identify the key signs. F stands for facial weakness. Look at their mouth or eye. They may be droopy and can't smile evenly. A, arm weakness. Ask them to raise both their arms. They may only be able to raise one. Can you raise both arms for me, please? S, speech problems. They're unable to speak clearly or might not be able to understand what you're saying to them. Ask them a question such as, what is your name? Can they respond appropriately? Can you tell me your name, please? T, it's time to call 999 or 112 for emergency help and tell them you suspect a stroke after using the FAST guide. While waiting for help to arrive, keep them comfortable, supported and reassure them. Do not give them anything to eat or drink because it may be hard for them to swallow. Keep monitoring their level of response until help arrives. If they become unresponsive, prepare to treat for an unresponsive casualty. So remember, to help someone who has had a stroke, use FAST. Facial weakness, arm weakness, and speech problems means it's time to call 999 or 112 for emergency help. And that's how you help someone who's having a stroke. If this video has been helpful to you, help support St John Ambulance by going to sjA.org.uk/donate.